Hi, everyone, and thanks for joining us today. I'm just going to wait a few more minutes to make sure that everyone has time to hop on. And then if someone can just maybe let me know in the chat, which should be to your bottom right, I believe, that you can hear me okay. I just want to make sure that's good before we get going. And again, we'll start in just a few minutes. I'm just giving everyone some time to pop on. Great. Thanks, everyone. Thanks for letting me know. This will be recorded and you get an email about it once we sort of finish it up. And then we do have a YouTube channel as well where it will be posted eventually. We'll just give everyone a few more minutes. All right, everyone. Okay, so just a couple housekeeping items. Feel free to ask any questions that you might have or comments in the chat, and then we'll make sure to answer them the best we can. If we don't have time, sometimes we'll send them out at the end. So definitely add any comments or questions in there. Again, this will be recorded. And yes, you are muted. We don't have that ability right now. So any questions or comments, just put them in the chat. And we're going to go ahead and get started. So thank you guys so much for taking time to come and join our webinar today. Semaglutide is a hot topic, super trendy, and so we'll go all in detail about semaglutide and some other peptides that are being used. We also did a great webinar. Dr. Wallace did a great webinar last year as well on semaglutide that goes into some other details and information. So you can always go back and look at that on our YouTube channel if you're interested. Alrighty, so semaglutide, Mastering Semaglutide, a comprehensive guide to optimal use and beyond. I am Dr. Berlin Wright. If you haven't met me or seen me before, I am one of the doctors practicing at Desert Wellness Center and love being here. So I'm super excited to do this with you guys today. Okay, perfect. All right, so what we're going to be talking about today, what are GLP-1 agonists and GIP-1 agonists, benefits and side effects of semaglutide and how to address them, how to use semaglutide safely and properly, common myths and misconceptions about semaglutide, updates on GLP-1 agonists, as well as other peptides, and other applications that might be able to be used for GLP-1 agonists. All right, so semaglutide is a GLP-1 agonist, which stands for glucagon-like peptide, and they are hormones that are naturally produced in the gut, primarily in the small intestines, and they're released while you're eating. And they stimulate your body to produce more insulin, which is released mostly from the pancreas, and this helps your cells to take up sugar from your bloodstream and be used. And then it inhibits glucagon secretion, and that's primarily what helps you to store fat, turns sugar into that. And so because of those mechanisms, it helps to decrease your blood sugar levels overall. GLP-1 agonists have been around for actually over 15 years. So I know they've been getting lots of traction, lots of, news recently, but they've been around for a long time. And then the most common ones that we've been hearing of, which is Ozempic, which is FDA approved to treat type 2 diabetes. That was approved in 2017. And Wegovy, which is also semaglutide, just slightly different, is a medication that was approved for weight loss in 2021. The main difference with those two medications is Wegovy is slightly higher dosing and the dose is just a little different. The other thing that we can do is use compounded semaglutide, which is what we primarily do in our office for a few different reasons. It makes it so we can start at lower doses and slowly taper up. It's easier to adjust doses as well, and oftentimes it's more affordable. The hard thing with those Ozempic, Wegovy, any of those medications is if your insurance doesn't cover it, which they have very specific sort of standards and guidelines for who is approved for it, it can be very pricey. And so the compounded version makes it more accessible for a lot of people. I put this little comic in there. So since I started taking semaglutide, I've lost several pounds around my belly, but gained a ton of unwanted commentary behind my back. The reason I put that in is because I hear all the time that, people are either, hearing people talk behind their backs, or people are very hush-hush about what they're using to help support weight loss. And I don't think there's anything wrong with having a little helper. As we get older, our metabolism slows down, and sometimes no matter what you're doing, even if you're doing all the right things with hormones and working on your diet and lifestyle, it can still be hard to lose weight and regulate metabolism and all that good stuff. And there's nothing wrong with having a little helper. And so I just don't think it needs to be this, stigma and hush-hush situation. So let's all be open about it and get more people to have access to it. Okay, and then I wanted to also bring up tirzepatide. So tirzepatide is a GLP-1 agonist and a GIP-1 agonist. So it's another peptide that's very similar to semaglutide, but it actually acts on two different receptor pathways. And because of that, some people report less side effects and potentially better results. The medication name is Mounjaro, which you might have heard of, and it is FDA approved. And probably the biggest reason that people don't use this for first is because it can be more expensive. And so if you're doing well on semaglutide or seeing results, we usually will start you there, but this is another option, either if you haven't done well with semaglutide, or sometimes if you did great with semaglutide, but maybe plateaued at some point, sometimes this will be that next little helper that we can add in. This is just a little overview of the two different sort of categories. So on the left-hand side is the glucagon-like peptide 1 receptor. So those are the GLP-1 like semaglutide. And then on the right side is the GIPs, which is like tirzepatide. And so this is going to go through sort of all the different actions in the body. It acts in many different places. So central nervous system, meaning brain and along there, the pancreas, definitely in the stomach, and then liver. And then additionally, with the tirzepatide, it has other effects on subcutaneous white adipose tissue, which is more, the belly area that we don't necessarily want where that fat is. And then can have a few additional effects with muscle and even decreasing triglycerides specifically. So lots of good benefits with both, but that's just sort of an overview comparison of those. Okay, so some benefits of semaglutide. Probably what most people want to know and are here for is the weight loss component. So most people are losing about 1/2 pound to 2 pounds per week with the use of semaglutide. There was some research that was published in 2021 that found that people taking semaglutide lost 15 to 20% of their body weight over 68 weeks, which is a good amount of time, compared with only 2.4% for people taking a placebo. So it's pretty significant that, we hear people saying that it works, and also in the research, it is showing that as well. And we really like that slow, steady weight loss. It's definitely easier to maintain. It's better for you. And so it works really well. Some other benefits: decreases appetite, helps to reduce cravings, which could be sugar or even other things. Increases satiety, so feelings of fullness, which can really help with portion control if that's something that you might struggle with. It definitely supports metabolism. It decreases how fast your stomach and sort of GI tract are emptying and digesting food, which helps with a lot of those other benefits that we see. It definitely regulates blood sugar, which we talked about a little bit, decreases inflammation, lowers cholesterol, and also reduces cardiovascular disease risk. These are just some of them. There are lots and lots of benefits, and some of them are still coming out because it definitely is still being researched, but these are some of the biggest ones that we have been seeing. All right, and then let's talk about some side effects. So some of the most common side effects are, I would say the majority of them are going to be gastrointestinal, so GI. Nausea, heartburn, or acid reflux, some indigestion, stomach pain, decreased appetite, which could be, a positive or negative depending on how much it's suppressed, constipation or diarrhea, and a lot of those primarily are because of how it's working and how food will sit a little bit longer in your stomach and intestines because we're decreasing how fast it is emptying and digesting. And so then sometimes it can trigger some of those symptoms. Headaches, fatigue, and dizziness can also be seen. The reason I put a star next to those is because oftentimes these can be related to the semaglutide itself, but oftentimes it's actually related to lower blood sugar since it is working on the blood sugar. So sometimes if you're not eating enough, or not eating regularly enough, or maybe not enough protein, something like that. Or if you're not hydrating enough, which is going to be super important to drink enough water. And then also something to note is when you're losing weight, oftentimes toxins are stored in fat tissue. And so when you're losing that, you're releasing it. And that can definitely cause some detox symptoms to go along with that. And so could be related to any of those different things. And then, something to note is we've really seen that most people who experience symptoms, it's usually the day or two after the injection, and potentially when we're increasing the dose at that time as well. But it's usually early on and then tapers a little bit. So person to person definitely varies. Also, definitely what you're eating and consuming can affect it. So eating more like processed foods, big heavy meals, fried foods, greasy, any of that kind of stuff. Sometimes sugary foods, alcohol, those can definitely all worsen side effects. So it's really important to make healthy dietary choices the whole time, but especially those days of the injection, day after, we really see that it affects it then. On the left-hand side just has the most common, 5 most common Ozempic side effects according to some clinical trials. So Ozempic being the same as semaglutide for the most part. They reported the most common were nausea, vomiting, which, I have had a couple patients who have experienced that, but it's definitely not what I see as one of the most common. And that might be because of how we're dosing some of the things we recommend in addition, but that's what they saw, diarrhea, abdominal pain, and constipation. Again, if you guys have any questions, feel free to put them in the chat and we will be working on those. Okay, so maybe you're taking semaglutide or interested in it, and we're thinking side effects. Well, what do we do for them? And you want to make sure if you do start this and do have some side effects, that there is something that can be done. So these are just some of the basic recommendations that we might give. There are many, many, both natural and sort of conventional over-the-counter medications that we can use if needed. But these are some of the most common side effects and then what we might offer. So ginger is actually really great for nausea. There's multiple forms of ginger. It could be, they have ginger chews, they have ginger supplements, they have ginger tea. So really any form can be helpful for nausea. If you're feeling more constipated, which I do see quite often, that it slows things down a little bit and you can feel a little bit more constipated than normal. So magnesium, specifically citrate, is really good for that. If you're feeling more indigestion, like things are just not digesting, sort of sitting in your stomach a little bit more, digestive enzymes can be helpful there. And then if you're having more heartburn, acid reflux, DGL, which is a type of licorice, actually is really great for that. And what I've seen a lot is the heartburn actually will come at night. So we oftentimes recommend taking this either, before bed, in the evening, before dinner, something like that. Again, with dizziness, headaches, fatigue, making sure that you're eating regularly, staying hydrated, adding electrolytes maybe to help with hydration. So those are just some options there. Okay, and then just a couple little cautions, contraindications. Want to be cautious if you have a personal history of gallbladder disease, like gallstones or any type of gallbladder attacks. This is just because when you're losing weight, it does put a little bit of strain on your gallbladder and can affect that. So it's not a contraindication. You could still use it. We just want to be cautious and know about it. If you have a personal history of depression or suicidal thoughts or ideation, we just want to be more cautious. And then a personal history of kidney disease. And then contraindications, things that we, probably you're maybe not the best candidate if this applies to you. A personal or family history of thyroid cancer. Really the reason for this is because in the research, and it's mostly with rat studies, but it has shown to potentially increase the risk of thyroid cancer, a specific kind, but we always want to be cautious. Safety is our most important thing. And then personal history of pancreatitis or pancreatic cancer is another thing, mostly because, this is having your body produce more insulin, working on that pathway. And since it's released from the pancreas, it just causes that to work a little bit more. And that's something we want to be cautious with as well. I got a question. What if you have no gallbladder? So it's still totally fine. There are no contraindications if you don't have a gallbladder. We might need to give you, some more digestive support, but it is safe to do that. Have another question. Have you seen hair loss as a common side effect? If so, how do you manage that? With weight loss in general, you can see hair loss, and that's oftentimes because your hair will actually shed more quickly. It goes through its cycle more quickly, which the hair growth cycle is usually about 3 months long. And so it'll almost push the hair more quickly through that cycle, which looks like more hair loss all at once. And so with that, we have supplements that can support hair growth. Some of it is just being patient as your hair regrows, but we absolutely support it in other ways. There are some great supplements like Nutrafol that we use and see good results with. But it is something that can be seen with semaglutide. I think it's more so because of the weight loss and metabolism changes that might be happening versus the semaglutide itself. But everyone can respond differently. There's more side effects than the ones I talked about that are possible, but those are just the most common ones. Okay, so some myths and misconceptions. I feel like there has been a lot in the news and research articles about all these negative things about it. And again, while there can be some negative side effects or things that might come up, if you're using it safely and properly, that's very minimal. And so we just wanted to make sure, we had a time to clear the air with all of that. So a common myth, using semaglutide means you can stop other diabetes medications. Of course, the original indication for semaglutide or Ozempic is for type 2 diabetes. And so a lot of people will have with those medications might have diabetes. And so it actually is often used in combination with other diabetic medications. And any adjustments to your treatment plan, so stopping or decreasing other medications, should be made through your provider who is managing that. So, I have seen people who have started semaglutide and they were able to either decrease or change some of their other medications, whether it was diabetic or it works on a lot of other things in the body. So, cholesterol levels or blood pressure levels, and sometimes we can adjust those doses, but those should always be done under the supervision of your healthcare provider. And definitely that's a case-by-case basis. Another myth, semaglutide is not for long-term use. So as of now, the research and data are showing that it is totally safe to use longer term if you're using it appropriately and being supervised with it. So really the most important thing is that we're monitoring it. So monitoring your labs and how you're feeling and the doses and all of that stuff. But as of now, there's nothing saying it shouldn't be used long term, which is awesome because it's such a great tool. And whether you need to do it for a few months, longer term, so there's lots of options there, but that's great news. Another myth, semaglutide is a substitute for a healthy lifestyle. So while semaglutide does help with blood sugar management and definitely can support weight loss, and sometimes even if you're not making any lifestyle changes, it's always going to be best to work on your diet, work on your lifestyle, your habits, all of those things, because it's just going to be supportive. And the goal for us, when we're doing it, is we want to make sure you're able to maintain those results after. And these are going to be the key components that help you to do that, is forming those healthy habits, working on your diet, exercise, all those other things, so that you're able to maintain. So I would say it's not a substitute, although you might still see results without changes. It's not a substitute. I think I saw a question pop up. Let's see. And I'll get to that after this slide. I think that'll be a good time. Okay, another myth, semaglutide causes severe side effects and is dangerous. So like any other medication or even supplements, they can have side effects, but severe reactions are very rare if you're using it appropriately and safely. And again, the biggest thing to stress here is that you're doing it under the supervision of someone who is well-versed, knows what they're doing, knows how to address the side effects if they come up. But I would not say it's dangerous if you are using it safely in the right way. Another thing that I've seen, and a lot of people have asked me recently, is about gastroparesis, which is basically where your stomach is just sort of halted. It's no longer moving. And research studies show that gastroparesis only occurs in less than 1% of users. And that's, again, I think a lot of it is based on dosing, making sure that you're a good candidate for it, and addressing any side effects if they might come up early so that they don't linger and you have this constipation that then turns into that. So, it's always a possibility that you could have side effects, but this is extremely rare. I have not seen anyone in my practice that has had gastroparesis. And then another myth, you'll gain the weight back after finishing semaglutide. So I briefly touched on this, but really the key here is if you're able to continue with the healthy lifestyle habits that you have made with the help of semaglutide, absolutely you can maintain after. I would say most of the patients who I've had that have been on it and then get off, they might gain a couple pounds back, but if they're really still working on those healthy habits, they've really been able to maintain, which is amazing to see, because what we don't want is that yo-yo, which lots of fad diets, you see the yo-yo effect where you lose a lot, but then you gain it all back, or maybe even more. And that's not really what I've been seeing with this. I think it does support metabolism longer term as well. There's some other changes that are happening in the brain and body that help to maintain it, but also it's those habits that you form. A question, what if you start and then stop abruptly with peptides for weight loss? So, we generally recommend doing more of a slow taper up and down. However, there's no contraindication or something that says you cannot stop them. And we've had people who have done that. You might just notice that, the things that it was helping with, your appetite, your cravings, might just come back more strongly, like very quickly. But there's nothing that says you can't do that. We just usually recommend doing a taper both ways. Let me see if there's any other. Any issues with people who are being treated for ulcerative colitis with Rinvoq? I would have to look into the specific contraindications with other medications. And so if you're interested in this, feel free to reach out, and we can always do, even a free 15-minute to chat if you're a good candidate for it. However, we'll talk a little bit later in the PowerPoint about other uses, and actually ulcerative colitis and irritable bowel disease, IBD, have promising research that it actually might be helpful. But of course, it's always a case-by-case basis. Everyone's different. And so it's always important that your provider is looking at all your medications, your medical history, everything, before you guys are deciding if it is a good fit for you. Okay, so semaglutide done right. I know there are tons of places that are popping up that are offering semaglutide, and it's really important to find a place that is reliable, that knows what they're doing, knows how to safely prescribe this and give it to you. So this is how we recommend and what we really emphasize with our programs. Semaglutide is a once weekly injection. It's subcutaneous. It's in the stomach or thighs. So this little picture is showing the areas that you can do it. Usually you rotate the areas, so it's not the same every day. And those little needles, those are going to be the insulin syringes that we use. So it's a tiny, tiny little needle. So even if you don't love needles, it's usually not too painful, not too hard to do. We do a slow taper up. So we start you at a really low dose, even lower than, Ozempic at their starting dose. And then we slowly increase as needed. So it's really, dose is patient dependent. So the goal is that you have minimal side effects while still seeing benefit. And, once you get to a point where maybe you're plateauing, or some of your cravings, appetite, that kind of stuff is coming back, then maybe we'll increase your dose. But the goal is not to necessarily get you at a specific dose. It's really patient dependent. I would say most patients are using this for at least 3 to 6 months at a time. There are always people who, might even need 1 to 2 months, but on average, 3 months is a good starting place. And then depending on your goals, your weight loss, your blood sugar levels, all that stuff, 6 months, or I have had patients who are on it 9 months, a year, maybe even longer. So the key aspects, which I have touched on a little bit already, but really getting enough protein intake. This will help to maintain your muscle and support metabolism. Also helps actually with your blood sugar levels and minimizing side effects. The actual number or amount of protein that you need will depend on your body weight and overall size and then activity level. So it's different for everyone. But this is so, so important. You might have also heard that, a lot of the weight loss with this is coming from your muscle, which if you're not maintaining muscle, if you're not doing things to maintain muscle, eating enough protein, strength training, that might be true. But from what we've seen, if you do those healthy, lifestyle habits, then you actually are losing more so from your fat, from the weight that you want gone versus your muscle. Anytime you're having weight loss, you will lose a little bit from muscle, but our goal is to minimize that. Eating slowly and not too close to bedtime. I did mention, I think that sometimes the heartburn or some side effects are usually seen closer to bedtime. And so just by bumping up the time that you're eating last can help to minimize some of those. Hydration is key. Water specifically, super important for this. This is going to help with weight loss, metabolism, helps with detox, reducing any potential side effects as well. You can definitely add electrolytes if that's something that's helpful to be able to get more water, but hydration, super, super important. I would say goal is at least half of your body weight in ounces of water per day, if not more. Strength training, so resistance training, weightlifting, any of that kind of stuff is also going to be super important on this. Again, because we're trying to maximize fat loss while preserving muscle. And that's one of the best ways we can do it, and is also helpful for metabolism long term, for maintaining weight, for, like cardiovascular function. All of that stuff is going to be maintained better with strength training. That doesn't mean, if you're an avid cardio person, you can still do that. It's just good to add in some strength training as well. And then again, finding a provider who is very well versed and can regularly monitor progress. And then everyone's plan is different, which is why we like semaglutide, because we can customize it based on the person. Let me see if there's any questions, and then I'll get into some other applications. Let's see, is it better to stay at a low dose for a while instead of going off of it completely? I would say this really depends on the person. We do have a lot of people who are on it at a low, almost like a maintenance dose for a while, and see a lot of benefit from that. But it really is just, person to person. Everyone's a little bit different, but that is an option for sure. Have you seen anyone that has had sugar cravings go away with it? Yes, absolutely. I see this all the time. Cravings in general for anything seem to be reduced with this, and I think it's because it works on pathways in the brain as well. Almost like rewires some of the brain activity to help with cravings. And we'll actually talk about that a little bit with the other applications and updates, but I absolutely have seen that it has decreased sugar cravings significantly, which is such a helper with blood sugar and weight for sure. Okay, so some other applications. These are some, upcoming research that is being done. It's still being done, and these are just some promising things that I was able to find. There might be more things, and these might change over time, but this is some really cool stuff that it could be used for more than just weight and blood sugar. So research shows that the GLP-1 agonist, which is going to be like semaglutide or Ozempic, can reduce the risk of heart attack and stroke by up to 20%, which is pretty significant. It improves overall metabolic health, and this is really because of all the little things that it's doing, helping with blood sugar, helps with your body's ability to use insulin, decreases inflammation, which is huge, and decreasing cholesterol levels as well. Some recent studies have shown renoprotective effects, which basically means that they're actually protecting your kidneys. Some other recent studies have shown that it should be considered as a treatment for a wide range of intestinal diseases. This could include IBD, which is like Crohn's or ulcerative colitis, intestinal mucositis, celiac disease, short bowel syndrome. And it's interesting because I've actually had some patients who have had GI symptoms, issues for a while, and they actually feel better on this. That's not everyone. Everyone's different, but I have seen that quite a few times. There's also some promising research in addiction medicine, and this is primarily because how it's working on the brain to reduce cravings and urges. So not even just with food, although that absolutely is helpful, but also actually with drugs, alcohol, gambling, like any type of addictive behavior, which is huge because there's not a ton of really great long-lasting things that can work on that specific pathway. A few other things that are up and coming. So semaglutide has been shown to significantly reduce nerve pain and pain in general. There's also some therapies or studies that have shown promise in liver disease, which is, again, amazing. There are effects with neuroprotective effects that decrease neuroinflammation. So basically inflammation in your brain, decreasing that can definitely help in the reduction of insulin and PCOS related symptoms, which is polycystic ovarian syndrome, which is, there's a lot of insulin resistance and blood sugar dysregulation that can go along with that. So it has been showing to help with that. And then also can help mediate or help with some other autoimmune conditions. All right, and then I just want to throw this in there. So this is a body composition scan, and we do these at the beginning of when we start semaglutide with a patient. We want to see your baseline, and then we generally do these about every 3 to 6 months to sort of monitor and, again, make sure that you're losing from the right spots, make sure you're hydrated, all of that good information. And so this one is, you can see the first one was done in April of 2023, and then again in July, and then just recently as well. The far right is going to be the earliest scan, and then the left side is going to be the more recent one. So the most important things to note here are fat mass started at 85 is down to 56. That is huge. Fat-free mass, which is going to be more muscle, started at 98 and went down to 89. And, she was working on her lifestyle, on getting enough protein, on strength training, all those good things. And so, yes, she did lose some muscle, but that is nothing compared to how much fat she actually lost. So that's really significant. And, you can't fight with numbers. And so they're right there. And then this goes through a lot of other stuff. So based on your sort of metabolic function, how many calories you should eat. So this scan has a ton of information that's really useful, but those are the things that I really wanted to point out, how significant that can be in just almost 9 months. And then if you go down a little bit more, there's a skeletal muscle mass. So that goes through specific areas in the body and the different muscle percentages and masses there. Right below that is also the total body water. So again, making sure that you are staying hydrated, and that's going to show us that. Okay. And then main takeaways. So semaglutide and other GLP-1 agonists or GIP agonists are promising in not only the treatment of weight loss and diabetes, but also multiple other areas of health. And I think that's still emerging. We're going to learn way more, but this could be a whole new sort of time for medicine with this finding with all these different benefits. It can be a great adjunctive treatment in addition to diet and lifestyle changes. We work on the whole person. That's super important. And, all those other pieces will play a role in your ability to lose weight, your metabolism, to be able to maintain it, all of that good stuff. It's very important to make sure you are using the peptides, that if you're using them, you're doing it safely, starting at low doses, and then being monitored by a provider who is very well versed with GLP-1 agonists. And we've actually been using these for years and have a lot of experience managing them. And then again, just everyone is different. So individualizing treatment plans and making sure that we address any side effects that come up. All right, so that's what I have for you guys today. If you have any other questions, I have tried to answer most of them while I've been going through it, but if you have any other questions, drop them in the Q&A or the chat box, and I will definitely answer those. This will be recorded and will be posted. I believe a link will also be sent out for you guys if you miss something and you want to rewatch it. And then, you know, we do offer semaglutide. So if you're interested in, you know, seeing if you're a good candidate or any additional information, just give us a call. I'll actually put the next slide is all of our information, our phone number and our email. So give us a call and we can definitely set you up with, you know, a consult for that, or we have lots of additional information just all up front. So give us a call if you have any questions. Let me see if there's any other questions that I didn't answer. Cost-wise, it really depends on, you know, the program that you're doing, how long, everyone's different. And so just give us a call and we can give you all that information and sort of the breakdown of everything. It depends, again, like we have packages, so lots of different options there. So if you're interested, definitely give us a call and we can give you all of that information and breakdown there. Oh, I think I missed one question. Any research for gastroparesis too? So the research that I saw for gastroparesis is that it has been shown to be in less than 1% of users. So it's not that common. And, you know, it probably is the few cases that did happen were the ones that came out in, you know, the media or wherever it was. But really in the research, it shows it's less than 1%. And also if you're monitoring regularly, if we are working on side effects, if we're doing dosing right, I think it will decrease any chance of that ever occurring. All right, anything else, you guys? Not too much. All right, sounds good. Well, thank you guys so much for joining us today. I hope you guys learned something. And if you have any other questions or you know, want more information, just give us a call and we can get you set up as needed. But yeah, thank you guys so much for spending lunch hour with me, and hopefully we will talk soon. Bye.